My name is Grainne Smith and I'm a Quality Specialist with the Tallaght West Childhood Development Initiative. In 2004, CDI undertook a needs analysis and from that produced a report called How Are Our Kids? We learned that there was an overrepresentation of children and families living in high poverty, lone parent families and numerous families experiencing stress due to multiple disadvantages. The CDI Healthy Schools programme sought to promote and improve child's health and well-being through a whole school approach to health promotion. The CDI Healthy Schools programme sought to improve children's health and well-being and access to primary care services. Its focus was on creating a whole school environment to health promotion. Following much debate on the needs of the schools, a process-led programme was decided upon. Schools were invited to express an interest to participate in the programme. In the end, 5 primary schools submitted an expression of interest to participate in the Healthy Schools programme. This work involved employing 2 Healthy Schools coordinators that were based in the schools to promote and drive the objectives of the programme. In addition, consultation was held with other HSE agencies to help support and drive this programme. In order to get to the implementation stage, a Healthy Schools working group was established which helped devise and develop the manual. From that, a steering committee was developed and it was represented by the 5 school principals, representatives from the local health services, County Council and CDI. This committee met once a month to help support and drive the programme, identify issues and needs. 2 Healthy Schools coordinators were recruited and support was given around the recruitment process. They were based in the schools on site to help drive and deliver the programme. Initially, some of the challenges faced were looking at integrating this role into a school. At the very outset, there was lack of shared understanding of the purpose and objective of the programmes, and therefore initiation of this process was slow. The manual had an implementation plan, but each school identified their local needs and priorities, and as a result, the Healthy Schools coordinators worked from this basis. Given that there was no actual programme delivery, training was not identified as a need at this time. The Healthy Schools coordinators had qualifications in adult education, psychology or social care. During programme implementation, training workshops were delivered to pupils and parents as needs arose. In order to support implementation, effective communication systems were established. These were a Memorandum of Understanding, which clearly outlined the roles and responsibilities of the schools, the funders and the Healthy Schools coordinators. The Healthy Schools coordinators received support and supervision from the HSE and subsequently received support and supervision through CDI. In addition to that, they submitted monthly reports to both CDI and the Steering Committee, which were reviewed at the Steering Committee meetings. Ongoing meetings were held with the Healthy Schools coordinators to look at the logistics and the day-to-day running of the programme. The Healthy Schools programme was evaluated by Trinity College. Overall, there were no statistically significant improvements in either process or outcomes for children. However, the report did note that the programme was ambitious in trying to achieve its outcomes given the time frame and recommended a follow-up evaluation. The subsequent follow-up showed that there was a 9% difference in levels of obesity in the intervention schools when compared to the comparison schools. Also, there was an improvement in peer relations and social support. Given the initial findings, the Healthy Schools programme no longer continues. However, in light of the most recent findings, discussions have been held with the HSE health promoting schools to discuss possibilities to collaborate on supporting schools to become more health promoting. Taking time to discuss schools' priorities and determining mechanisms in which schools can take ownership of these programmes is worth consideration. While this programme didn't show any initial positive findings, it's important to bear in mind that change takes time, especially a whole school change. Schools value the health and well-being of their pupils, but require support in order to implement a whole school change.